Hello, I'm Nicolas Piuzzi. I'm a joint replacement surgeon at the Cleveland Clinic. Currently, I'm the Vice Chair of Research for the enterprise for the Department of Orthopedics, and I serve as the co-director of the Musculoskeletal Research Center and the Cleveland Clinic Adult Reconstruction Research Group. So, I have multiple areas of interest, and I would just start by saying that we're trying to address what are the critical gaps that we have in joint replacement and musculoskeletal, trying to advance our field. So I'll start with with kind of mapping out what are the critical gaps and what's our vision and approach to that. The critical gaps that we have to target now are osteoarthritis. And then in my area of joint replacement is how can we improve outcomes of those patients who have joint replacement and fail. So we're actively working trying to provide more predictable outcomes, decrease those patients who fail to improve in pain and function improvement after surgery. And also we're working hard at trying to improve the treatment of periprosthetic joint infection. Our vision statement is to advance evidence-based orthopedics through a personalized approach. So basically what we want to do is we want to try to create the best quality and the best level of data that we have and be able to bring it down to the patient level. So for us to publish a paper or do research that just stays in the journal or stays on a book, it's not truly valuable. What we believe is valuable and what we're trying to do is just linking that and bringing it back to the individual patient, John Smith, that we're doing a knee replacement. So how can we provide him a risk stratification, be able to provide tools so that we can guide them through surgery through a personalized approach that it's fit and made based on the needs of each individual patient. So early on, when I started my journey in orthopedics, I got the honor of training at the Italian Hospital of Buenos Aires, which is a very old hospital that has been in functions for more than a century. And I've always been kind of trained under the framework that to be a good clinician, you needed to do research, you need to be involved in education and have that like triple thread or three pillars. That was one of the things that drove me to the Cleveland Clinic for training and then for practice, where we have this commitment to the three-parted mission. So patient care, research, and education. So I've always knew that I wanted to be involved in those three parts that are key and they're interconnected in the fact that you communicate the findings, and every time you try to teach something, you end up learning more than what you teach. You research the problems of your patients and the field, and then you implement and bring that down. So I think I was driven by a passion of trying to make a contribution, create an impact, and be able to help not only the patients that I get to touch with my own hands, but also those patients who are treated elsewhere, and just try to move our field so that we can do surgery and take care of conditions across the musculoskeletal field in a better way, in a more impactful, and where we're having added value in the process. Of mentors. Mentors comes in a lot of different shapes and forms and stages of life. Um, I've had mentors for different aspects of life that if I have to give you the full list, it will be complicated, but I'll give it then. I'll start with the mentors that were in my family. I think my parents were my first mentors and the first motivations of me being where I am. Later on, across my family, it's like my wife and the support of everybody around me, because at the end it's mentorship that comes in multiple ways. On the professional side, I would have to thank so many people, right? From early in practice to even earlier in residency. Comes to mind Dr. Luis Muscolo, um, Dr. George Mashler, who was the key person that actually hired me and brought me to the Cleveland Clinic. And through the years, multiple partners and colleagues that I would be doing a misservice trying to list all of them. But I do truly believe is kind of what we put on the award is that we're like dwarfs standing on the shoulder of giants, and I've only been able, if I've only been able to see farther and more clear, is because of the work that all of them have done and put forth and given, and I just hope to be just a little part of that. So we're working a lot of things. We have different programmatic areas that we're trying to make a dent. Personalized medicine and risk stratification and outcome prediction tools are at the forefront of how we use machine learning and artificial intelligence in the way of advanced analytics and how we bring it back to clinic. And that goes in multiple ways, in how to use it in the shared decision process before surgery, how do we use it to optimize the care that happens around the OR and within the episode, and how do we guide the recovery afterwards, looking at the different recovery curves and making sure that we detect complications early and we can deal with them at the right time, and even better if we could prevent them. So that's one of the main areas that we're putting emphasis on. We're also working a lot in robotics. We're working a lot in periprosthetic joint infection, trying to work on mitigating any infection that happens and improving the tools that we have to treat them as well. We've also created, and we're actively working in osteoarthritis. We have the Center of Excellence in Osteoarthritis, trying to develop new targets and new treatments for how we deal with osteoarthritis. That is a huge burden for our communities and worldwide. And when we put all that together, we're quite busy with different aspects and areas, but those are the top priorities if I have to name them. So it takes a village. In the Cleveland Clinic Adult Reconstruction Group, we have, depending on the year, so far we've been averaging 10 to 15 people.
Oh, wow.
Between research fellows, coordinators, program managers, research analysts, statisticians. So it's a big group that works behind the scenes and in the engine of our group. And also in the Center of Excellence and in the Musculoskeletal Research Center is a much broader and larger multidisciplinary team that comes into action. And they would not be able to do their job as well if it weren't for a very large group of clinicians and their clinical teams that are also involved and deeply committed. So our clinical teams with PAs, nurses, admin assistants, they're all key parts on this system. So when I look at the team, it's an amazing large team. Challenges have been countless, and there's never a day short of challenges. I would say that one of the main shortcomings that we have in our field is the lack of funding to musculoskeletal research, and I think that's something that we need to keep highlighting. Musculoskeletal conditions are at the top of the list in burden of disease across our society. They are top one in healthcare spending in CMS and our healthcare system. Nonetheless, when we go and we look at funding, the funding allotted is not even in the podium. It's not even high up there. So we need to work and develop increased awareness of how we need to develop research and strategies and investment to try to advance the field. Why? Because a patient that has arthritis or has a musculoskeletal condition will not be able to provide for their family, will not be able to enjoy their retirement. And even if it doesn't affect or is not a life-threatening condition, the effects on society are tremendous. So at any point, I will be advocating against research to cancer, pediatrics, or heart and vascular, which of course, they drive mortality and they're key aspects. But I think we need more awareness on how we work on trying to find answers for musculoskeletal ailments and treatments. So that's one of the main shortcomings, right? How do we make sure that philanthropic efforts are focused and targeted towards musculoskeletal? How do we work and lobby with different federal funding agencies to try to increase awareness and support? And how do we, more importantly as well, how do we capture and attract the brilliant minds of the present and the future to come to our field so that we can hopefully find solutions and answers to the multiple questions we have. So ORS has been a fantastic community where I found a home of people that are committed to the same mission and vision that I share. I like to start with a phrase of one of the mentors that I highlighted earlier on, Dr. Musculo, and he would always tell us as residents, um, if you want to see what's currently it's being done or what has been done in the last 10 years, go to AAOS. But if you want to see what's going to happen in the next 10 years, you have to go to ORS. And I think that's where my love for ORS is being able to share with the researchers, the engineers, the PhDs, all those very smart people. And as a clinician and a clinician scientist that I am, or scholar, is being able to go and share and learn from them. And you always leave energized. And it's played a great role. I mean, finding collaborators, finding an environment where you can thrive and you can actually make an impact. And I think that summarizes in kind of like what's my love for the society. You will love it. I mean, it's something that you need to be passionate about it. It's not easy, but nothing good in life is easy. But it's very rewarding. And I'd say that it's very rewarding because in general, things that are rewarding happens in a community setting and in a team. And research, especially in the last 20, 30 years, has become more of a team science. We see less and less those environments where it's just a one person. So you build connections, you build networks, and I think that that's what research today in 2025 is, and that's extremely rewarding because you get to work in teams and you get to achieve goals and different milestones that would have been impossible to achieve by yourself. And that at the end of the day, it's very fulfilling. Oh, awards and success. I'm thankful and I'm grateful and I'm very happy for our team. But for me, it was more valuable and important the journey than the end result. I mean, I look at the award and I'm happy for our team, for the recognition of everybody who've worked hard and kind of helped us and myself be where I am. And I'm extremely grateful. And I think these are always kind of nice incentives to reinforce a direction. But at the end, I think that the satisfaction is not on the award, but it's on the work done. It's the journey and each of those long days and weeks and months and years of persistence of being able to set a goal and work tirelessly along your team to achieve that. And that I wouldn't say that the award is what necessarily gave it because the satisfaction was there already. We had done it, but it's always kind of like reinforces and it's a nice it's a nice catapult for the future where we come together and now we we kind of have tailwind to continue. So when I'm not in the lab or working, what do I like to do? I love to spend time with my family and with my friends. I enjoy going for a run. I enjoy doing barbecues, Argentinian asados outside. I love to go fishing. And anytime I can and watch football or soccer in the US, I enjoy it. But spending time with family and friends is at the top of the list.